Thank you for the reminder.
This time I
Hello,
click
hello,
first.
everyone. Yeah, the fastest finger. Hi, Dario. Good afternoon, everyone. For people who are joining us, this is our monthly report briefing, and as always, basically, as we've been doing this year, it's always myself here in Singapore and Dario, who is usually based in Singapore, but who is joining today from
Europe.
Berlin, his hometown.
From a beautiful,
yeah.
gloomy Germany, which is about 20 degrees cold. Yeah. It's good to see.
Yeah,
It's good to see many.
It's
good to see many known names on the list and many new names as well. So, good.
Yeah, let me check.
Yeah, nice.
Oh yeah. Oh yeah. I know 1, 2, 3,
4, 5.
Yeah, we can't mention the name, but I just wanted to say hi.
Hi to those who know us very well.
Exactly. No, thank you so much for joining. And the specialty of this month's debriefing basically is that we will not be talking about a specific topic, but we'll be presenting the overall status of digital health in Asia Pacific for the first half of the year. So we just released our report, actually globally, and then we have the regional focuses. So we have one for Asia Pacific, one for Europe, and of course for North America. And then in these reports, we have small snapshots of what happened in the Middle East and Latin America as a relatively smaller landscape, but still you can find some data on these regions if your focus is that part of the world. As always, let me remind you that the back of these reports that we release is indeed Health Tech Alpha, that is our proprietary platform. And for those of you who would like to explore more and maybe also slice and dice the data behind the report, please feel free to sign up to healthtechalpha.com. Dario, again, welcome. You're not frozen, right?
No.
Yeah, for a moment you were very serious there.
I was carefully listening to what you said.
Yeah, thank you for your attention. I would like to start sharing my screen, and we're going to share a couple of slides, but you have a bit of visibility also of the concrete data. And maybe Dario will play a bit also around the platform, just to showcase you the evolution of what was published a week ago and what the status as is right now is with HTA. So let me just share my screen with, let's say, the summary of the report and those key data points that, let's say, are the headlines of this half year in Asia Pacific. The biggest one, indeed, being the funding crunch in China, followed by India, which have led to the APAC, which has usually been the second region in terms of funding, both volume and value, to move into the third place, and Europe moving into the second place, with the US always being the first one. For survival, we have seen an increase in partnerships, because that's, let's probably call it the silver lining, because it's also a way of accelerating adoption and let's say embedding the ventures into the operational, let's say, part of healthcare, instead of just surviving because you have lots of money, lots of cash injected. So probably I would say this is the positive side of decrease in funding. And then we have more data. In order to give color to exactly these data points, I would start a bit the conversation with Dario and ask him to comment a bit more on the status. Let me just share it here. with the overview in Asia Pacific. It's a very nice slide which gives some details of how much money went where, basically.
Yeah.
Over to you, Daria.
Let's probably start 2 slides earlier when you can go up quickly.
Okay. Sure. Whatever we agree doesn't matter.
Just put 2 slides earlier. Yeah, exactly. Yeah, no, this is good. 14 is good. 14 is good.
Okay, cool.
Okay, just to put a bit of color behind that, and again, if you have any questions that are either unrelated to what I'm currently talking about, but you just want to have an overall knowledge, just put it also in the chat or in the Q&A function, and we just get to it whenever we have time to that. But let's look a bit back and look into the history of where funding also went to, and then we can see of where we're currently entering into and why this is also such a big thing at the moment. Just by looking into Q1 and Q2, we've seen that this year has been extremely slow. Q1 had a cumulative of 355 million in Asia PAC, Q2 461, which is then adding up to about $817 million in total invested, which is overall very low as compared to the previous quarters. When we just compare, we haven't seen such low quarters in the past 4.5 years. So there's really a massive crunch in funding. Now only then representing around 8% of the global ecosystem. And when we compare this also with the previous years, in 2019, we've never fallen really much below these 20% overall, apart from 2021 being a small dip. But 2022 actually, considering that the global funding crunch was significantly stronger as compared to APAC, actually saw a bit of this rebound, actually having the highest value share that we've previously seen. Now only having 8% in the first half is therefore a big thing, considering that there are many different economic factors that are clashing at the same time with one another, showing this dramatic decrease of funding that we see overall. Now you can go 2 slides slower, and now we can basically a bit look more into of what we're actually seeing.
Some kind of a perfect storm.
Yeah, so if you recall some of our earlier reports going back into 2020, 2019, 2018, you've always seen that both China and India have been very much upfront, generally sharing anything between 80 and 90% of the global fund of the Asia PAC funding that we are generally seeing. Now this year, they've both fallen cumulative to below 40%. We're actually at around 35% now, what they're only representing, which is basically a crunch of around 50% of what we previously seen in terms of value share. When we look on the left-hand side, we've now actually seen Australia jumping ahead. This doesn't mean that Australia is such a great country of investment at the moment. It's just that the economic factors in Australia haven't really changed compared to the previous years. And actually, if you take one particular mega deal out of the equation, also Australia would have probably fallen below Japan in terms of what we see within funding, which is where they generally always are placed in. But both China and India have seen massive funding crunch. If you recall some of the earlier reports, we've seen China crossing 2 billion in a half a year, and now actually just representing 150 million, most of it, which is very, very early stage. Now, the effect that we see in China are many different. One is that we see still the aftermath of the tech crunch that we've seen under the Xi Jinping government. Therefore, basically seeing that investors are very scared of actually making a particularly high investment. At the same time, there's still the China-US trade war that we are seeing, Chinese companies delisting from the Nasdaq and from the New York Stock Exchange, having going back to China itself, which by itself doesn't necessarily shine a good light on the ecosystem overall, considering that there's no exit option. You don't necessarily want to list on the Shanghai Composite or on the Hong Kong Stock Exchange, considering that the stock markets are not that strong, and therefore there's always economic uncertainties when you try to list on these markets. You had a few companies that delisted from the New York Stock Exchange, went back into Shanghai, fell out, and are now listed on the OTC market, which is generally the lowest class of where you can list within the Chinese ecosystem as well. It's like a secondary market that doesn't necessarily have much purchasing power. Now, India is a different ecosystem as well. In case you're following a bit the past 12 to 18 months, you've heard the stories around Farm Easy, wanting to list at a very high valuation of around, I think, $5-6 billion, now raising actually a loan, now actually raising a debt financing to pay back a loan at a 90% cut of their previous valuation. And again, this is very negative feedback that a venture can get, and therefore the investors become more scared of actually putting money into startups that have necessarily seen a very high valuation uptake. In case you're following me again for a few years, I've always said that we've seen overvalued ventures in both China and in India, and this is now basically hitting us, that the multipliers between funding, raise, and valuation have been overly strong, which is not necessarily a good sign. Yes, it always sounds good. Or we've raised 10 million at a 200 million valuation. It's nice, but it will bite you at some point. And this is exactly what we see with PharmEasy. Lots of over promises and under delivering in terms of the revenue that is coming in around these ventures. That's the perfect funding. That's the perfect funding storm.
Exactly. Thank you for that. If anyone has any questions, please just drop them in the chat area or in the Q&A session. We can take them from both the sections, and happy to answer. Since we connected a bit the partnerships increase with funding, I would move into the partnership side, and maybe again you can share a bit more of layers of why the growth, basically, what's happening and where it's happening.
I'm going to do this a bit live because it's always nice to have a slide, but it's probably also nice to do a bit more dynamic. So let me quickly take over. Overall, when we look into partnerships, I've already done a slice earlier and only look into the first half of it. We've seen over 1,000 partnerships that were disclosed throughout the first half of this year, which is quite strong. I think we've demonstrated something like a 1.5 increase as compared to the previous half year. Overall, there are currently 20,000 plus partnerships that we are currently tracking. We would never say that we have every single partnership. We're probably the ones that have the most comprehensive selection of partnerships that we are tracking within the system. Now, the 1,000 here, this is currently globally. So when we slice this down into Asia Pacific, we have around 203 partnerships that were disclosed this year so far. Now, Asia Pac, you generally have only a few very meaningful ecosystems of where partnerships are very active. Japan is one, Korea is one, China is one, India is one. The other markets generally lag a bit behind in terms of partnerships, considering that the solutions are very B2C centric. So your go-to-market strategy is very much direct to patient, although you can do a B2B2C model whereby you're working with an intermediate in order to reach out to your patients. However, these are very often customers, and you don't necessarily share with whom you're working. So again, these sort of partnerships we wouldn't track. But the partnerships that are coming out here out of Japan, for instance, are very often around, for instance, strategic partnerships in order to bring your research forward, or again, to partner also with an ecosystem somewhere or with a government and so on, to actually start increasing the value of the offerings that you have. Now, when we just look into, let's say, the first 50 here, you see that the most of the partnerships throughout the first half year were probably disclosed in Japan. Now, this is generally quite interesting, considering Japan has a very strong ecosystem, both on the academia side. Therefore, partnering with them generally brings you forward, but also the insurance companies are very active within. But when we just look into who actually partners here with whom, so out of the 200, and you just see the majority still stays within the academia side. But when we look into the more interesting corporate verticals, so let's say pharma, this will bite me, so I need to do pharmaceutical, otherwise I also have pharmacies. We have actually seen that there are only 27 partnerships, so about 10% of them, which is generally, when you now look into the names, yes, you have a few of the multinationals. AstraZeneca very active within China, and they just reconfirmed that China is one of their strategies moving forward. They remain very, very active there. But you also see very smaller pharmaceutical companies, yes, Hawaii Pharmaceuticals, AstraGene, Angok, which are very regional, national pharmaceutical companies that are very active within the markets as well, where they're operating from. So overall, it's quite an interesting ecosystem. Let's just look quickly into the insurance side of it, how many we've seen there. So far this year, it's only 8. So pharma companies still lead the pack when it comes to, let's say, pharma insurance. The MedDev as an example of how we are there, currently trailing 7, it's even less. So pharma is still within Asia Pacific the strongest partner for digital health ventures to actually partner with, then followed by some of the other MNC type companies as well. But academia is still the majority of what we see. I give back to you.
Yeah, super. No, thank you also for the live demo of the platform, also to showcase a bit the ability of indeed our core product. Allow me then to continue sharing a bit, and I would like to continue the conversation with a more narrow focus and basically move a bit on the clusters. What's happening if we take our taxonomy and see how the clusters have been doing from a funding perspective, and what are those examples? Why did it stop sharing? A second.
Because you click cancel.
Okay, yeah. I think because I checked. Yeah, here it is. Okay, voila. Okay, so here we're presenting the clusters view. So what are those top clusters that attracted most of the funding?
Yeah, so again, we always need to see that the entire funding is currently not where it used to be. So we are working with significantly lower numbers, therefore showing that every larger investment is very prone to drive a particular cluster very much in front of the pack. 2 examples here, both Kakehashi and Cellular Medical. Just look at the remote devices, 187 million invested last year, so 2 years ago now, so in 2021. We've actually seen it at position 12. Now with 150 million invested, it jumped off to the 2nd place within the pack. So it was a huge jump over just 24 months. Kakehashi, the same. We have 60 million roughly invested in their Series C extension, total funding in health management solutions of 202. So if you just take these 2 deals out, neither health management solution nor remote devices would stay on top of there. But then the ones that initially also saw most of the funding, attractiveness, research solutions, online marketplaces, medical diagnostics, have also seen a huge bump that they hit, and therefore we've seen significantly less funding invested across these classes as well. So I wouldn't necessarily call these numbers very significant, considering that larger investments generally drive it forward. But you just see that online marketplaces initially was, when you just think again 2 or 3 years back, has always been the highest cluster in terms of investment. It's seen a huge dip by just showcasing 70 million. If you just think back to some of the investments that we've seen into Farm Easy or 111, so EEE within China, where we've seen $200, $300 million investment. These days are currently over, and therefore we don't see significantly value of funding going into that. There are certain reasons behind that. When you see the ecosystem overall down, you generally become, as an investor, more scared to start investing into these clusters, considering that there's such a negative effect currently represented in them, that you start looking into investment mandates that are a bit more stable. Generally, medical diagnostics is one of them. If you have a venture that is providing a medical diagnostic solution, there's generally significant value also in the technology that is being provided, instead of just a volume-driven game, which are online marketplaces generally. Research solution as well.
It's easier to capture the value of that. Easier
to measure the value.
Yeah.
Even though it takes longer to provide an ROI, considering that you do need to provide the clinical effectiveness, the clinical evidence behind that. You need to showcase that your solution works. The uptick later on, after achieving clinical evidence, is significantly higher as compared to an online marketplace that just thrives to provide you your CAGR, your not your CAGR, like your cost on goods sold, your COGS, COGS, and what's your revenue margin that you can bring in. Yes, for markets like India, Indonesia, China, it makes sense to still have these sort of solutions, but you currently have market leaders, and just trying to take a bit of market share away from them is quite a difficult game. So it's always a long-term game that investors also need to understand.
Fascinating. Continuing on the same page, but changing again the entry point, let's say, of the analysis, looking at the therapeutic focuses. So let me move a bit on. Yeah, the view here. Okay. Also here we have a name, two names actually that are quite familiar.
Yeah. So again, it's quite an interesting one. So we've seen that 28% have been disease agnostic. If you again just think a few years back, generally the split between disease agnostic and disease driven has been generally a 50-50 share. So you generally see that we are missing a huge proportion of ventures that are disease agnostic in their nature, where generally online marketplaces and health management solutions are falling under. Now, with them having a funding crunch, ultimately the therapeutic focus area is more, it's more weighted towards solutions with therapeutic focus. And within those, we see neurology, diabetes, cardiovascular staying on top this year. Oncology traditionally has been the biggest driver, again, of funding. We've seen a lot of research going within the next-gen sequencing and the support in terms of identifying biomarkers, medical imaging sort of solutions in order to detect cancer earlier, and then the genomic tests to also do more on the hereditary side, but lung cancer as well has been always a very strong topic as well. Now, this one has seen a huge dip in terms of funding. Even last year, this has been on position 1. Now this year it has fallen from 1 to 5, only sharing 66 million, which is probably the lowest that we've seen since forever. I can't even think of any report where I've ever presented 66 million in the earlier years there. Neurology now got promoted. There's been lots of talk around neurology, especially on the medical imaging side, digital biomarkers, and the entire cognitive therapy that is non-mental, so more on the neurology side, looking into Alzheimer's disease, etc. We've seen a lot of drive in recent months and years, and now by effect it starts getting promoted also to the first row. It's still one of the most invested therapeutic areas overall. So when we speak about pharma, generally oncology takes around 60 to 70% of the entire budget of a pharma company that has oncology as their focus. So think about Roche, etc. But when we just think about companies like Otsuka, Eisai, etc., they're heavily investing in neurology at the moment. And therefore, we start seeing that there's also a lot of adoption, active partnerships that are happening, etc., despite seeing some of the fallbacks that we've recently seen with pair therapeutics struggling, some of the other digital therapeutics struggling within the neurology, mental neurology sort of space.
Yeah. Can I please ask you if you can share a bit more of the value proposition of S-alpha therapeutic? What do they do? Because I mean, at least me and you, we're quite familiar with Hallmask and Health5Me, but the first one probably.
Okay. So S-alpha therapeutics, again, a Korean venture, incorporated about 4.5 years ago. Very much on the digital therapeutic space. So if you think about your pair therapeutic sort of style, very similar to that. The solution that they have, let me think, I think it's SAT001002, one of them, is the product that they're currently bringing out or doing their research on heavy partnerships as well with some of the pharma companies that are existing within the Korean space, but still very young, considering that they're still very much in the research phase. You do need to bring your product out and drive clinical awareness. They've started also with the myopia space. So it's very much between this neurology and ophthalmology side, and therefore currently raising. Now, people may see, okay, they've raised 8.41 million in a Series B. That is rather small. Yes, when we compare this on a global scale, it's rather small. But when we think about Japan and Korea overall, Korea by itself has a very strong ecosystem where the government supports very early the partnerships between academia and the subsidizing with lots of grants. So companies generally don't rely so much on external funding, considering that the government is providing them with a lot of support in order to kickstart their journey. Yeah. So generally Series A, Series Bs are significantly smaller as compared to what we see in other markets like the US, the UK, even Germany, etc. Funding rounds are much smaller.
Fantastic. Thank you, Dario. Lots of information and color on the pure numbers that we've shared on the slide, basically. The audience is being quite shy and silent, I would say. Any questions that Dario hasn't answered in this briefing of the reports?
It doesn't seem to be, like, probably
I was waiting one, at least from one of the names.
No, just to probably share one more slide, and then we can slowly but steady also wrap up. No, this is not my slide. This is my partnerships. Just by looking into the value drop that we've seen over the years, when we look into oncology here, so this always shows the change as compared to the previous half year. When we just look into oncology, and then we can just calculate back, between last year and this year, we've seen a drop of 261 million. And before that, we've seen a drop of 314 million. However, this is basically over the past 12 months, we've lost around 600 million in funding in oncology alone within half a year. And we now see where we basically ended up with that is, where was that little slide? Nope, this is APAC, I don't know. We are literally then stuck with so little funding left within. Cardiovascular has seen a similar drop here with 70% drop half year on half year, which is a huge drop as compared to what we've previously seen. And even though here neurology, and then the other example, which is now on top, yes, it has seen also funding crunch similar to the other therapeutic areas, but not that massive, and therefore it by default got promoted to the first spot, not because it attracted more funding over half year, it's just because it hasn't lost as much as some of the other therapeutic areas that we've seen. Which we always need to consider when we read reports. It's like, how do you interpret some of the numbers? Yes, it might seem very positive. Yes, neurology seems to be very positive, and it got promoted. But again, we still saw the drop overall. Yeah. And then the last one, probably also to highlight here, is also mental health. Many people spoke about it. Yes, there's been lots of demand.
It was a hot topic. Yeah.
It was a hot topic. Everybody wanted to jump onto. We've seen probably 100 new mental health companies popping up, providing teleconsultations. Great. Yeah. How much is value add within? Rather little. At some point, people will go back to a psychiatrist or see their friends, so they don't need mental support anymore. So most of them that have raised a lot of funding over the years started actually dropping. Now we got
sustainable. Yeah, we have two questions actually from someone who is eyeing Australia as an interesting landscape. So the first one is Australia actively fostering their startups? And connected also to the second one, Saluda is the big investment in Australia. Without it, where does Australia stand compared to previous quarters? I think we've talked a bit about Australia and how small
slightly
the landscape was, but yeah.
Slightly touched on that. So this was a private equity investment overall. So the stage can't really get established within, probably a late stage funding somewhere. If you just take the 150 million out, it stays at 70 million. So 75, 77, which would stay between Japan and Singapore, which is where traditionally also stood. Now, as I was saying, we are dealing with so little numbers this year, or so low numbers overall, that a single investment that is extraordinary can pump you to the top. quite easily. This is exactly what happened to us, to Australia. Because again, one of these numbers is like, oh yeah, it's nice to see Australia on top. Now let's dig really into it. And does it actually mean anything? Not necessarily. It's just a single one-shot fly that is there, and it will go away again next year or next half year. Probably Australia will still end up the end of the year somewhere around 400 million, maybe slightly below that. So not traditionally significantly higher. Now, in terms of the fostering, Australia has always been a very insular ecosystem. Pun intended, a very insular ecosystem. Generally, Australian ventures built for Australia with the hope that they can expand subsequently to the United States, which is generally the path most Australian companies are going. And when you build within Australia, you deal with a very small ecosystem overall. We don't speak about many million people living there. And also pharma companies or insurance companies' budget for Australia is rather low as compared to some of the other ecosystems, especially the United States. This is why they always want to go there. Language barrier to the US is lower. This is why Australians always try to go to the US as well. So always try to go east, not very west, however we want to see it from there. Generally, you don't see many Australian companies expanding into Asia Pacific, which by ecosystem would actually make much more sense considering of the distance, similar time zone, etc. But then your valuations are also lower. But it's very difficult for startups to actually attract funding in Australia as well. Most of the investment that we see are either angel investors that are very active there, which are Australians for Australia, or we do see a few early growth stage investors. We do not see any late stage investors in Australia. Most of the larger investment deals would then be into ventures that have already ventured out of Australia and have established themselves also in other markets.
Yeah, overall, I would add that there is support. There is this push to foster startups because, I mean, Dario, we've been talking to a number of organizations based in Australia. And again, from a public perspective, there's a huge attention to the topic of digital health and to having that indeed embedded into the healthcare system. For more data, please review our past reports so that you can compare also how Australia moved in the past 2 years, basically 3 to 2 years. Everything is online, so feel free to download and read and check by yourselves, basically.
Yeah, many of the programs are supported by the government. I think the Australian government, it was either this year or last year, launched this digital health ecosystem launchpad.
Yeah, there's and also
And then there's Ant Health that is very active within. There's this entire Invest South Australia ecosystem as well. Melbourne launched their Melbourne Digital Health Ecosystem, etc. It's generally from province to province or state to state, how the Australian ecosystem works. And then there's lots of funding from the government also provided in order to just kickstart certain things. But again, it's such a small ecosystem overall.
Yeah, it remains. Yeah.
It remains rather small.
Cool. Thank you. Excellent. Thank you for that. Any more questions? We are past half the hour. So if there are
we want to leave you with your afternoon coffee.
Afternoon coffee. Yeah, it's brewing.
Cool. So to probably finish off, many thanks everyone for joining. If you have any questions, and I are always ready to chat with you. Drop us an email, a LinkedIn, and a call when you're in Singapore as well. So let us know how we can help you.
We're quite reachable.
We're quite reachable. So let us know if you need anything. Otherwise, this will also be on our YouTube. And otherwise, we wish you a great afternoon or morning, wherever you are in the world.
Thank you so much. Thank you, Dario, again for the explanation. Thank you, everyone, for joining. And have a nice day ahead. Oh, wow. Should we take this one? Okay.
Thank you.
Oh, thank you,
Thank you, Anna and Dario. Thank you, Al.
Yeah, I know
Bye.
this guy. Thanks.
Bye,
Bye everyone.